Welcome to the EMR4All project. We're exploring how OpenMRS 3 and Raspberry Pi come together to create electronic medical records for disconnected facilities. Today, we'll take you from pilot programs all the way to scaling this solution, showing how technology can bridge gaps in healthcare access. Let's dive in. In many remote and underserved communities, running a traditional electronic medical record system just isn't feasible. It's nearly impossible. Without digital records, patient information gets lost, fragmented, and inaccessible. That hurts care quality and slows public health efforts. Paper records are costly and hard to maintain. Reliable power is often missing, and internet connections are unstable or non-existent. These barriers keep digital health out of reach for many primary healthcare centers, creating a real challenge we need to address. When we talk about digitizing healthcare across Nigeria's primary health centers, an offline-first electronic medical record system is the most practical way forward. Why? Because many of these facilities face unreliable internet and frequent power outages. They still rely heavily on paper records, which makes patient care fragmented and reporting inefficient. An offline-first EMR lets healthcare workers capture and access patient data without needing constant connectivity. Then, when the internet is available, all that information syncs up seamlessly. This approach supports integration with Nigeria's national health system and helps accelerate universal health coverage. It's about making sure no facility gets left behind. We've designed a portable device that's all about ease and flexibility, perfect for remote areas where moving equipment can be a challenge. It's lightweight, thanks to Raspberry Pi hardware, which also slashes infrastructure costs by up to 80% compared to traditional servers. Our EMR runs completely offline, powered by a simple power bank, so it works even where internet and electricity are scarce. Built on the trusted OpenMRS platform, it delivers secure, scalable, and interoperable healthcare solutions right where they're needed most. OpenMRS is more than just software. It's a global community of over 5,000 members, working together across 80 countries. They support more than 8,000 health facilities and manage over 22 million patient records. This network includes everyone from national governments to small clinics, all united by a shared goal: improving health outcomes in underserved areas. With a modern tech stack and a commitment to open standards, OpenMRS adapts to any clinical setting, making healthcare data accessible and useful worldwide. Our mission is clear: to make patient records accessible anytime, anywhere, no matter the internet connection or available resources. Between 2023 and 2026, we've made steady progress on EMR4All. We started with deploying OpenMRS 2 on Raspberry Pi 5, proving the concept. Then, we built a multi-site data synchronization module, ensuring data flows smoothly between devices and the cloud. We've optimized the hardware to handle heavy data loads, deployed an AI agent for offline patient analysis, and created Docker-based installations to streamline deployments. This timeline shows how each step builds on the last. Let's talk about how we keep data flowing, even when the internet or power goes down. We use a lightweight Kubernetes sync module to replicate the online electronic medical records onto Raspberry Pi devices. This means healthcare workers can access patient records offline, no matter what. AI runs right on these devices too, turning plain English questions into SQL queries for detailed reports, all without a connection. Then, a Python script syncs data back to a central server when possible, so information stays up to date across clinics. It's a full patient management system, running smoothly on Raspberry Pi, designed for real-world challenges. Let's take a closer look at the EMR4All medkit hardware. It's built to keep data safe, even when power cuts happen, thanks to an integrated UPS that prevents data loss. The kit runs cool, too, with an active cooling system designed for hot climates. Its rugged case stands up to tough field conditions, making it truly reliable. Plus, it can operate on simple power sources like power banks or solar panels, cutting costs and boosting power reliability in remote areas. Inside, you'll find high-volume storage and a powerful Raspberry Pi setup for smooth, uninterrupted performance. We're building on OpenMRS 3X, fully supporting FHIR. That's fast healthcare interoperability resources, the modern standard for exchanging health data. This means data flows smoothly between systems. We've integrated automatic reporting to national DHIS2 platforms, helping with public health surveillance and planning. Plus, our team developed a Python sync module to keep multiple sites connected to a central server, even across distances. EMR4All ensures your data talks seamlessly to national and international systems, making sharing and interoperability effortless. Let's talk about cost and how the system is supported on the ground. We have a local team ready to troubleshoot and gather feedback, plus dedicated tech support to keep things running smoothly. The solar panel powers a Raspberry Pi server 24 hours a day, ensuring constant uptime. We're planning to scale up lab and pharmacy services, covering registration, visits, drugs, and reports. The system runs OpenMRS 3 offline, with a built-in wireless hotspot. This setup is already successfully implemented at Dr. Idris Ibrahim Kuta Memorial Primary Healthcare in Minna, Nigeria. Now, we're focusing on training health facility workers to use the system effectively. This includes deploying the EMR4All Med Kit, a compact setup with a Raspberry Pi, new equipment, and solar panels for reliable power. We're customizing the HIS version of O3 Lite to include antenatal care and tailored forms. This rollout is happening across 5 health facilities in the Changa local government area of Niger State, bringing technology directly to where it's needed most. Now, let's talk about stakeholder engagement and our partnership model, with a focus on advocacy. This is where we build strong relationships and rally support around our cause. Advocacy isn't just about speaking up, it's about creating allies, fostering trust, and working together toward shared goals. When stakeholders are truly engaged, they become champions, helping us drive meaningful change from the inside out. This slide highlights how collaboration fuels our impact. Let's talk about how this initiative works on the ground. We start with volunteers and interns, then gradually hand over to a local team. The Ministry of Health owns the data and the system that's key for sustainability. The platform is open source, which means it's adaptable and transparent. In many places, funds for devices or training are tight, but there's already government-paid staff ready to use the data. This system helps clinics collect payments and manage services, especially in rural, hard-to-reach areas where traditional systems struggle. It's designed to give ministers the clear data they need, and many of these leaders are young, tech-savvy, eager for solutions that work beyond cities. Plus, it comes with its own power supply, making it practical anywhere. This slide highlights the business model and how we engage stakeholders, crucial for adoption and funding. Let's talk about how partnerships between ministries of health and NGOs can really make a difference. The goal is to meet primary healthcare needs affordably, while building trust and knowledge together. We focus on training implementers and using existing infrastructure to keep costs down. The system should be easy to set up, plug and play, solar-powered, and online for updates without travel. Governments want ownership, sustainability, and solutions that fit their strategies. When we get this right, health data flows smoothly, and everyone wins. That brings us to the end. For more information, you can visit www.EMR4All.org. Stay connected through the OpenMRS blog, wiki, and partners, or join the conversation on OpenMRS Talk, LinkedIn, and Twitter. Let's keep the momentum going. Together, we can make a real difference. This video was created with SlideSpeak. Visit SlideSpeak to turn your presentations into engaging AI-narrated videos.